It's me, Nurse Kathiana, and today we are unbagging my nursing bag. This is a required bag by my school. Does it say my school name on it or anything? No. Okay. So it doesn't say my school's name on it, so I can show you. So this is required by my school for my program. It's basically for our labs that we'll be using every week. It is $100. We'll talk about that later. So I'm just gonna be unboxing it, telling you a general idea of what the stuff that you will be using is and what it is for. If you are just like, what is this for? What is, Kat, I see that you have this. What is it for? What is it used for? So that's what I'll be doing. So let's get into it. All right. So let me put this down. So the first thing I pull out when I go in this bag is an IV kit. Well, just the primary set. You use this for patients that are on specific antibiotics, and it can't be by the mouth. It has to be through the veins, especially a lot of patients with C. diff, which is a disease in the stool. It smells terrible. It's not my first time with IVs, but I do need to refresh on my proper technique for that. I don't do them right now because I am working at assisted living, so we don't really use IVs at all. So yeah. Next thing I have are some gloves, medium gloves. Excuse my nails. So yeah, just some medium gloves, another IV kit, another one. I have a tape measure, it looks like. So yeah, just a regular schmegula tape measurer. You use that for the patients that have wounds or any redness, bruising. You definitely want to measure how big it is and then compare it to what it is now to what it can be, or if it's getting smaller, if it's healing. That's very important. I have some more gloves. I have scissors. And the scissors are very important because in nursing you do wound care. Well, depending on what kind of nursing you do. In a rehab, you definitely are doing wound care. Assisted living, depending on what your rules are for your site, you may or may not be doing it. I don't do it right now, but I have done it in the past. You also can use the scissors for everyday things. The residents asking you questions, open this, cut this, whatever. So these are very important. All nurses should carry scissors with them wherever they go. I don't care. You need to have scissors. Just like your stethoscope, you're not going to walk around without your stethoscope. Don't walk around without your scissors, because if you ask me to use mine, I'm going to say no. So yeah. Just kidding. I have a suction catheterizing kit. So this is a suction cathetering kit. I only use this one time in the rehab. What you use it for is disgusting. If you ever have a patient with a tracheostomy, or say that patient is hospice, and a tracheostomy is a hole in your neck for breathing. They can't breathe out their mouth for whatever reason, or their nose. Doctor can sometimes put a tube in their throat, and if that has to get changed, you have to take out the tubing and change it and clean it, and it's like it's disgusting. The mucus gets everywhere. It's nasty. It's disgusting. I don't like suctions. I would never do respiratory nursing. I don't want to deal with your mouth and your mucus. That's on you. you know, if you can't, I can't. I'll literally be sick with you. Like, I can't. That's something I don't think I could do. I have a dressing change kit, which is, dressings are called wounds. Wounds and dressing go alike. Dressing is the wound covering, if that makes sense. And so I would definitely use my scissors, you know, to cut the old one, and then use this, and this is sterile. Anything inside this box is sterile, and this can be my sterile field on a table as I'm changing the dressing. And as I learn what they want us to specifically know in school, I will be teaching you guys. So that'll be fun. Y'all can see me in clinicals with my uniform on and doing dressing changes and showing you the proper way for suctioning. Let me know if you want to see that type of stuff. I have a suction catheterizing kit. Again, I told you what that is for. I have a tracheostomy clean and care tray. So this is the sterile tray that you would use while changing a tracheostomy. I have a Foley catheterizing, let's see if I can shake this away that you guys can read it. A Foley catheterizing training tray. This includes a towel, a specimen label, the lubricating jelly, a drain bag, oh, and it includes the 14 French catheterized. So a catheter is, if your patient can't pee for some reason, or, you know, they're not getting all the urine out every time they use the bathroom, sometimes the doctor can say, okay, well, go in and get me a specimen, a sterile specimen, or see if they're retaining urine. So the patient can either self do it, or we go in and catheterize them. So we go up their pee tube. Guys, you can Google it if you need the specifics. And we go in and get urine. And it has to be very sterile, because if not, the patient can catch an infection, and that's not good, which is a UTI, a urinary tract infection. So you have to be very, very, very careful. The place I work at now is very strict on that, because it's easy for someone not to clean possibly, or you not use a sterile technique and then infect the patient. It happens. And then I have another catheterizing kit. So that'll be fun. So yeah, that is all for my unbagging my school supplies. Quick update on school. I went to the school, I picked out my classes. I have like the perfect schedule. Mondays 10:30, Tuesdays till 12:30, and then Wednesdays I'm at clinical 7 to 7. So I think it's 7 a.m. to 7 p.m. So yeah. How have I been getting ready for school? I have been practicing my math, or as my old pharmacology teacher would say, my maths. She was Jamaican. Shout out to you. So I have been practicing my math, because that's definitely not my strongest, but I will make it my strongest, knowing that I'm going into this program, because I want to do really good. Try to get A's in math, just so I don't have that slacking me down. I got the medical dosage calculations book, and this turns out to be the book that I will be using in school, so that's definitely good news. I've just been going in, refreshing my mind. Anything that I feel weak in, I'm doing it every day. I'm trying to make it a habit of practicing this every day, and I've been doing good so far. I've been relearning all my measurements. You need to know your measurements as a nurse. You need to know your measurements. No ifs, ands, or buts. You ain't gonna pass if you don't know your measurements. So I've been going in and doing my measurements, So if you're going into nursing school, I would definitely recommend this and get a head start on your measurements, do your math, practice your math, all that stuff, because it definitely comes in handy. You don't want to be that weak person waiting last minute and struggling, don't have time for nothing. I'm gonna be chilling because I already did my math. I practiced it on my time off before school. So yeah, that concludes my little update and unbagging my school supply kit. If you guys have any questions, you can definitely leave them down below. Please subscribe, thumbs up, like this video. I like doing them. If you guys don't like this topic, let me know what you guys would want to see. I do want to do a lot more content when school starts, but that's when school starts, and that's 2 weeks away, so I didn't want to just not have anything. So if you did like this, thumbs it up. And that's all. I'm Nurse Cat. Bye.